Hi guys, it's the Dental Assistant Tutor here, and today I'm going to go over the amalgam setup in case you need to have a review. So, when you're setting up, as in my other videos, the basic setup, the mirror, explorer, and cotton pliers will be the first ones. So on my tray, I will grab my mirror, explorer, cotton pliers. Now, in some cases, some people like to have, or assistants like to have, two cotton pliers out. If you need to reach into a drawer, I recommend having a second pair out. So one's a clean pair and one's a dirty pair for the patient's mouth. So I'm going to set these all the way to the right in case I have to go in a drawer. If you don't have an extra pair, then use a paper towel with your glove to reach in and grab. Once you have the basic setup, you will have the spoon excavator. Try and get it to where you guys can see it pretty good. And what the spoon excavator does, see it right there, it scoops. It scoops out the decay. After the dentist has used the high-speed handpiece and maybe the slow-speed handpiece, then they'll use the spoon excavator. They have a small spoon and a large spoon depending on what your doctor wants. And remember, when you're passing the instrument, you're going to pass going like this. At the opposite end of the working end, opposite end, and pass straight forward like that over the patient's chest. Once they scoop out the decay and they clean it up, for your instruments, you will use a amalgam carrier, okay? And this can be anywhere on the tray, or it could be with the amalgam capsule and amalgam well. An amalgam well looks like this, but metal. I don't have one. So will be an amalgam well, and you can use one of these for amalgam well. And we'll set that over there. And then what I like to do is get a few extra carpules or capsules of amalgam. And remember, when you're doing amalgam, there's different ones. Some have a push button. You push, and then you insert it into the amalgamator machine. If you do not know how to work that, I would watch a video on it. Some just have a capsule that you just stick into there. Either way, there's alloy and mercury inside of this. You do not want to open it up. You do not want to spill it on the floor. If you do, you do not vacuum it up. There is a amalgam spill kit that you can use at your office, that every office should have, according to OSHA standards. So anyway, there's 1 spill, 2 spill, or 3 spill when you order these. 1 spill has less than 3 spill does. So if you know you're going to do a whole quadrant, I recommend getting a couple 3 spills out. If you got one little tooth, 1 spill. So I'm going to put that in my amalgam well like that, next to my amalgam carrier. Then you need your condenser. Once you carry the amalgam to the site with the amalgam carrier, you need an amalgam condenser, okay? And you always hand the small end first, okay? If you're working on the lower, if you're working on the upper. Once you do that, you have to smooth the filling, make it shiny, lock it into the walls of the clinical crown, the surfaces of the teeth. Now, the next thing would be used is the football burnisher. Looks just like a football burnisher, okay? One end has a ball. Chances are your dentist is going to use the football end first. So all this time we've been handling the small end first. But when it comes to the filling, it's better to get the larger football to get it smooth faster. Once they smooth it and lock into place, they use the diamond burnisher, also called the acorn burnisher. I've also heard it called in 30 years the ice cream topper and the diamond burnisher. So just so you know, and the proper name is the anatomical burnisher. So you got anatomical. If the dentist asks for that, you may go to another office and they might ask for the diamond burnisher. Just know these different names, and it looks just like a diamond, okay? And that's right after the football burnisher. So think of it this way. This might help you. I just thought of this. You got the Super Bowl, And then you got the diamond ring when you win the Super Bowl. So football first, then the diamond, if that helps you remember the order of use. Then after that, you have the discoid Cleo carver, which carves the anatomy into the tooth. Or carves it into the Super Bowl, what is it, award, you know what I'm talking about. The big football that they get. Anyway, discoid Cleo carver, it's spare shape. One end is kind of round, but that's okay. Normally they just use the spare shape side. Now, if the dentist is checking the bite, because you'll have articulate paper on there too. Sometimes it's red and blue, sometimes it's just red, sometimes it's just blue. There's different thicknesses of it, okay? And normally you have our articulator holder that would hold it. I don't have one, but it will go like that, and the patient will tap, tap, tap a few times, grind around, and if any of the teeth marked blue, then that spot would be high. And then what they would do is take their discoid Cleo carver back, and they will carve the amalgam a little bit more. That is your instruments for the amalgam tray setup. Your materials that you would have extra on there would be a cheek pad or cheek diaper. Comes in different colors, comes in different sizes, small and large. Even though they're pedo, a lot of adults can use them, okay? And when they get inside the cheek for a minute, and you place it inside the cheek, it can get dry up against there, okay? So take your water and squirt your water between the cheek and the cheek diaper, okay? And that will loosen it up so you can take it out. But sometimes if they get too full, it looks just like a diaper inside the mouth. So change them out if you have to throughout the appointment. So therefore you should have a few extra on your tray. So I'm going to set that to the side. You would want extra cotton products like your cotton rolls and your 2x2 gauze to help clean up. When your dentist is scraping with the discoid Cleo carver, make sure you have your HVE right next to the tooth, okay, that's being worked on, because normally what they'll do is they'll take their discoid Cleo carver and they'll go like that while the suction's on, just to help clean up the mouth. Because amalgam scraps, especially if you're moving an old one to put a composite filling in, you really have to use the air and water and check the vestibula, check underneath the tongue, have them lift their tongue up, rinse, do it a few times for the patient. If it is a MO, a DO, or MOD, that is when you would use a matrix band, okay, Toffenmeyer matrix band. There's different bands, and I have a video on that you can watch at another time. But you would have, how many ever you have, if you got 3 teeth that need MOs or DOs and are right next to each other, have them all out and ready to go. It is your job to know how to assemble them, and also have some wooden wedges out. Wooden wedges help prevent overhangs, so you have to have that also. Sometimes you might have an extra articulate paper to the side to where it won't get contaminated. In case you don't use it, you can put it back in the drawer. You do not want to waste the materials that you use to fill the teeth, but you definitely want to have everything ready to go for the procedure. Doctors do not like assistants having to get up in the middle of a procedure to go grab something. So try to have extra if you need to. This is a disposable bite block. So the patient will bite down on it like this. Okay? If you have these in the office, I suggest that you recommend them. If the dentist is not utilizing them, just try out a few pedo ones for adult patients if they complain of jaw ache and stuff like that, because it will help them when they're open for a long period of time. Plus, it will help you when you're having to retract the tongue and suction, you know that they're open, okay? There are color ones out there that goes by sizes if you order them. And also there are the typical black ones. And some people with the hoe tie a piece of floss long enough that if it was to fall back, they can grab it to retrieve it. Always be cautious. You would also use Hemoseal or some type of cleaner when they're doing the procedure, after they clean out all the decay with the spoon excavator. Then they would use the Hemoseal. Along with that, you might have a micro brush or two out. Normally dentists like the fine micro brushes. They're like the color white. And of course, if it's deep enough, they're going to need the anesthetic syringe. And what goes with the anesthetic syringe? It is the Topical Applicator. Don't forget to have that out. And your patient's x-rays. Either have them up on the monitor on the computer. For the dentist, do not have them retrieve it. They should be ready to go next to their gloves. Okay? Always put your doctor's face mask, unless they use them throughout each patient. You shouldn't do that, but if they do, you know, put a mask out for them and extra gloves. If you know that they go and numb the patient, okay, and they throw these gloves out, we'll have 2 sets out. That way you don't have to get another pair out. You know they're going to use it, all right? And if they don't touch it, they're not contaminated because where they're sitting on by the keyboard. And make sure you wipe that keyboard off too if you use your gloves typing notes. If the filling is deep enough, you would have to put an insulator. And nowadays they have a light cure one that they can use, or they can use DiCal, which are 2 tubes, a catalyst and a base about this size, and you mix up just a little bit on each tube on a mixing pad. You mix it up with this, and then you hand it to the dentist, and then they put it inside the tooth, and it takes a little time to set up. With the amalgam filling, it takes longer to set up, at least up to 72 hours. So tell them to be careful biting on that side. If they feel like the filling is high, once the numbness goes away, tell them to call the office, and you can get them in to make an adjustment, which takes less than 5 minutes. But then you also have to consider you have to clean up the office and the treatment room and all that stuff. So that's it for the amalgam setup. So for the post-op instructions, I recommend that you practice in front of a mirror so you're not nervous when you have to be ready to go with your first patient after amalgam procedure. So here it goes. Okay, so today, Bob, we did your filling on the lower right side. They don't really know tooth numbers, but you can tell them also. Tooth number 18. It was pretty large, so we did put a base in it for you to keep it from being sensitive to hot and cold. It's going to take a little bit to get it back to normal, but be careful that you don't bite your lip, cheek, or tongue, because you are numb. If it's the lower, their tongue will be numb. If it's the upper, just say, be careful not to bite your cheek, okay? But basically, tell them don't bite their lip, cheek, or tongue with all the procedures that get numb down here. Just if you say it that same way, you won't forget. Don't bite your lip, cheek, tongue. Lip, cheek, tongue. Okay. And then soft foods the rest of the day. Eat on the opposite side. In the old days, the dentist will polish the amalgam filling the next day, which will make it stronger and last longer and shinier. But a lot of them don't do that nowadays. So just keep that in mind. I just thought that would be cool to know how things have changed. And let's see here. That's basically it. And then you have your tray set up. What I like to do is, so the patient doesn't see everything, I'll take their patient napkin and I'll fold just a crease of it long ways and clip it. That way it doesn't bother their neck. And then with the bib clips on there, I put the bib clips over the bib and just lay it over the tray. So if there's any kids or anybody with them, they won't see the procedure tray set up because they'll get nervous about it. You understand about dental because you're in the program, you're taking a course, or you're just self-educating yourself on it. But the average Joe does not understand, and so they see these tools and they can get nervous. I don't care how tall they are or what sex they are, some do get nervous. Now in some cases you might need a cotton roll holder, okay? And there's a right and left one, and it's only for the lower. When it's faced this way, this part is for the lingual side. So you would just insert it this way. You can't put it this way So it's for one side. And then the other one would be, I don't have one for the side out here on my deck, but you will go in and this lump will be on this side. And what you do is you take your cotton roll, you squeeze it and push it on here. And then this taps up underneath the chin. Like that, okay? They also have a mouth prop that clicks, okay? And you kind of lay it to the side, and it has rubber tips that you change out when you're sterilizing it. You need to have your handpiece ready, and most doctors will use a round burr in the slow attachment and a 330 or 557 burr in the high-speed handpiece, okay? And what you do is you push, most of them are push button nowadays, but you push the button and you push it in the hole, okay? And you check it. Always check it. Always check it, because you don't want him to pick that up or her pick that up and start drilling and the burr goes flying in the mouth. And whenever they pick up the handpiece, they shouldn't have to tell you. It is your cue to pick up the HVE, okay? HVE, your high volume suction, okay? And after the procedure, you want to oil it. Oil the handpiece. And some of them have machines now that you just hook it up, push the button, and it runs it. If not, you grab the can and you oil it. Some dentists will also use etch and bond to do as a first layer for amalgam filling. They feel it's more sterile. So, don't think they're wrong for doing that. It does make sense. But that's basically about it. So that's your amalgam setup. When you're doing charting, remember to color it all the way in the surfaces, okay? The composite filling is an open circle, so remember that. And if you're using computers, well, it just says amalgam. You click on it and life is so much easier that way. Alright guys, that's the amalgam setup. Until next time, take care. Bye. Don't forget to like and subscribe. I'll be making more videos to keep you guys in review if you need it, or if you're just starting out and wanting to learn. It's best to learn from many different people just to know how others do it. And there's so many different instruments out there. Don't get overwhelmed. Just study the basic ones and you'll learn along the way, because dentistry, you never stop learning. So don't forget that. Bye.